I'm Aisha Thomason, and you know Ashley Kirk.
Hello.
Today we have a special guest, Cindy Shaw, our Director of Clinical Management.
Yay!
So Cindy's going to talk a little bit about how she works with our nurse practitioners, especially our new nurse practitioners in the onboarding process.
So during orientation is when I first meet the providers and get them introduced to Care Tracker, and that's the EMR system that we use with ICP. And I'm able to help them troubleshoot once they're in the facility. I go with them to get them set up, their computer working, to get their computer working with the facility's EHR system, whether it's PCC or AHT, and I can help them get oriented to that.
That's what I think is so nice too, is that you're there to help them with that, office type stuff, because they're there to, of course, get to know the residents, get to know the staff, get to know where everything is. So it's just nice for them to have someone there right alongside with them for their first few days, first week in the facility.
It is kind of scary as a new nurse practitioner. You feel like you're kind of out there by yourself because you're in this one facility, but just knowing that Cindy is a phone call away or a Zoom call away, and she can help talk you through anything. If there's a clinical judgment issue that needs to be done or documentation, Cindy gives constant feedback on those things so that they don't feel alone. They feel very supported.
What I really enjoy about the ICP experience is that I do get to talk with the nurse practitioners on a daily basis for those first 90 days. I really try to integrate them into the system, and that we can have a good dialogue between us, so that they're not afraid to bring up any problems that they're having in the facility, so that I can jump in and try to pinpoint what's going on and to help them work better in the facility.
Another thing that I really appreciate that you do is that whole orientation on site when they go into that new facility, and you teach the facility as well as the nurse practitioner the communication protocols that need to occur. Mm-hmm. So they know exactly how they need to contact her or communicate with her a change in condition of the residents.
Yes, and I do bring a communication book in that ICP provides, and it's a hardback notebook with communication sheets in it that the nurses can keep at the nurses' station, so that if they have a patient or a resident that they're concerned about, they can write that in that book, and the nurse practitioner will look at that when she comes in the morning and before she leaves in the afternoon.
Thank you, Cindy, for being here. We are so thankful to have Cindy on our team.
I'm so thankful to be here.
Yay.